affect the family. It affects the patient very much, of course, but it affects the family tremendously so. And I think it's incredibly important for the caregivers to make sure that they get as much information as they can about Lewy body dementia from as many avenues as possible, whether it be the Lewy body dementia association, the Alzheimer's association, whatever avenues possible, and also to try to set aside some time for themselves to also seek out some assistance if need be, to set a schedule, to really look and see where their needs are. And every caregiver has different needs. I mean, there's no one size fits all. That's the bottom line. Everybody has different needs, and different caregivers know what their needs are. Some caregivers need some help in the house. Some other caregivers really struggle with the physical demands of the Parkinsonism. Perhaps they're frail themselves and they just need a little more help with some of the day-to-day things like house cleaning, or perhaps even some of the physical cares that their loved one requires. And so it is very important, I feel, that we of course are focused on the research and focused on trying to understand the disease, but it is also important that we take care of our patients by looking at how we can help them by also helping the caregivers.
So it's true that you actually have a support group for Lewy body dementia?
We do here at the Mayo Clinic. We have a caregiver support group, and it's actually not specifically for Lewy body dementia, although many of our Lewy body caregivers do attend. So it's really multiple different types of dementia victim caregivers are present, and I think that's good, actually. It's nice to have people representing different types of issues and problems and different stages of conditions, and I think people derive a great deal of support from knowing, well, what worked for you and how did you handle this situation, and well, we're past that, but now we're dealing with this. And I think people do derive some not only emotional support, but practical suggestions and practical advice. And we not only provide forums where we discuss with each other in the caregiver group, but we also provide some educational opportunities here where we have speakers come in to speak and provide information about the different conditions and about what's available.
I think Mayo has some documents as well that they've produced on Lewy body dementia.
We do it.
REM behavior disorder.
Yes, we do. Yep. Yep. On our website.
Those